If you are turning 65 anytime soon, or if you are getting ready to retire, I need you to sit up, put down whatever you are doing, and listen to every single word I am about to say to you right now. We are talking about Medicare. And more specifically, we are talking about your initial enrollment period. I know. You see the pile of mail coming to your house every single day, glossy brochures, colorful envelopes, companies begging for your attention, and it feels completely overwhelming. It makes you want to throw your hands in the air, freeze up, and say, "I will deal with this later." Do not do that. Freezing up when it comes to Medicare is one of the single most expensive mistakes you can make in your entire retirement. I see people do it all the time. If you are not already drawing Social Security benefits when you turn 65, nobody is going to automatically sign you up for Medicare Part B or Part D. Nobody. You have to take control of your own financial destiny and sign yourself up. And if you miss your window because you were confused, or because you put it off, or because you thought you could save a quick buck by waiting, the federal government will penalize you. And they will not penalize you just once as a slap on the wrist. For Part B and Part D, those late enrollment penalties get added to your monthly health insurance premium for the rest of your life. I do not want that for you. You worked far too hard for 40 or 50 years, saving every dime, sacrificing, and building your nest egg, to let administrative penalties bleed your hard-earned retirement dollars dry. So let us stand in our truth today and get this completely crystal clear so you never have to pay a single penny in penalties. What exactly is your initial enrollment period? It is a very specific 7-month window created by Medicare. Think of it as a 7-month timeline centered right around your 65th birthday month. It opens 3 full calendar months before the month you turn 65. It includes the entire month you turn 65. Now, what do you actually need to do during these 7 months? Medicare is divided into different pieces, and you need to understand how each piece works so you can protect yourself. First is Part A, which covers hospital stays. For most people who have worked and paid Medicare taxes for at least 10 years, or 40 quarters, Part A is premium-free. It costs you $0 per month in premiums. So if you qualify for premium-free Part A, signing up during your initial enrollment period is usually a total no-brainer. Next is Part B, which covers doctor visits, outpatient care, lab tests, and medical equipment. Part B does require a monthly premium. This is where people start getting hesitant. They look at the monthly cost and think, maybe I can skip Part B for a few years until I get older or sicker. Listen to me very carefully. If you do not have active health insurance from a current employer where either you or your spouse is actively working, and you skip Part B during your initial enrollment period, you are walking right into a financial trap. If you delay Part B without qualifying coverage, your monthly premium goes up by 10% for every full 12-month period you could have had it but did not. If you wait 2 years, that is a 20% lifetime penalty tacked onto your Part B bill every month. If you wait 5 years, that is a 50% penalty for life. On top of that, you cannot just sign up whenever you realize you made a mistake. Then we have Part D, which covers your prescription drugs. Here is another big mistake I see all the time. People say, "Susie, I do not take any prescription medications right now. Why would I pay for drug coverage I do not use?" Here is why. If you go 63 continuous days or more after your initial enrollment period without creditable drug coverage, Medicare starts charging you a Part D late enrollment penalty. It is calculated as 1% of the national base premium for every single month you went without coverage, rounded to the nearest 10 cents, and added to your monthly drug plan premium permanently. Now, there is one major exception you need to know about. What if you are turning 65, but you are still working, or your spouse is still working, and you have health insurance through that job? If you work for a company with 20 or more employees and you have active employer group health coverage, you are generally allowed to delay Part B and Part D without incurring any late penalties. Notice I said active employment. COBRA does not count. Retiree coverage does not count. VA benefits do not count the same way for Part B. Only current, active employer coverage gives you a special enrollment period later when that job or coverage actually ends. If you are on COBRA or retiree health insurance when you turn 65 and you think you can skip Medicare Part B, stop. You will be penalized, and your private retiree or COBRA plan can retroactively refuse to pay your medical bills because they expect Medicare to be your primary coverage at 65. So what is your actionable takeaway today? What do you need to do right now? First, grab your calendar today. Look at the month you turned 65. Circle 3 months before that month. That is your start line. Do not wait until the month you turn 65, because if you sign up in the 3 months before your birthday month, your coverage starts on the very first day of your birthday month. No gap in care, no stress. Second, if you are still working at 65, go directly to your Human Resources department. Ask them specifically, is my health plan considered primary creditable coverage for Medicare Part B and Part D? Get that confirmation in writing. Third, if you are retired or do not have qualifying employer coverage from active work, go to ssa.gov or medicare.gov during those 3 months before your birthday month and enroll in Part A and Part B. Choose your prescription drug coverage or Medicare Advantage plan, get your coverage structured properly, and protect your hard-earned wealth. Being financially secure in retirement is not just about how much money you saved in your 401k or IRA. It is about protecting what you have built. It is about making smart, timely decisions so that you never give away your money to avoidable fines and penalties. You have the power to control your financial future. Mark your calendar, take action on time, and stand tall in your retirement.